Hello everybody, my name's Brenda Friel and I'm an improvement advisor within Inverclyde Health and Social Care Partnership. I'm just going to give you a presentation about the Inverclyde Dementia Care Coordination Programme, our achievements and our learning so far. Okay, so just to recap on our aim of the programme. So what we're wanting to do is to support improvements and redesign of community-based services to improve the experience, safety and coordination of care services and support for people with dementia from diagnosis through to end of life. What we're trying to do is to support people to stay well at home or in a homely setting for as long as possible. So we're taking a whole systems and pathway approach, and by March 2022, we aim to improve care coordination for people with dementia and their carers. We want to develop and evaluate a model of effective care coordination, and what's important that we share our learning across Greater Glasgow and Clyde, Scotland and wider. So Inverclyde Health and Social Care Partnership, following an application selection process, were the chosen partnership to take this forward. So before I go on to our learning, it's very important to know that we didn't do this on our own. It very much involved us working with our stakeholders, and this just demonstrates the range of people that were involved in the programme. And also what was really important as well, that we involved people with the lived experience of dementia and their carers. So Inverclyde has a dementia reference group and they've been involved right from the start. So we had an agreement in place. They didn't want to sit on a big steering group. So we put this agreement in place that there would be a two-way form of communication. And they've been really heavily involved in the programme, having informed lots of pieces of work and really appreciate their involvement. So I'll go back to the launch event, which happened in September 2019. At that stage, we had over 90 people attending this launch. And we then looked to see, right, what is it we want to do? What areas do we need to improve on to improve care coordination across the whole pathway? So in doing that, the pathway was divided into these 5 stages. So stage 1 was noticing changes. Stage 2 is that process of getting diagnosed. Stage 3 is that 1-year post-diagnostic support stage that aligns to Alzheimer's Scotland 5-pillar model of post-diagnostic support. Stage 4 is following post-diagnostic support, that individuals with dementia are being supported in the community to live well and as independently as possible. And that aligns to Alzheimer's Scotland 8-pillar model of community support. And then stage 5 is where that's a more complex, at the more complex stage at palliative and end-of-life care. And this aligns to Alzheimer's Scotland Advanced Dementia Practice Model. So as you can see right through this whole pathway, carers and their family feature throughout, and obviously, and also the role of technology, which we've looked at as well, and underpinned by a dementia-friendly Inverclyde. So this was what was planned right from the outset. However, as we know, the pandemic came in to play, and we had to then review our priorities in the time we had left. So, and it was good that the programme was extended. So what we looked at was stages 3, 4 and 5. So I'm going to share with you our actions and progress against them for these 3 stages as follows. So you can see there's a number of actions here. I'm not going to get into detail just now because I'll talk through them later. And also we had a number of actions that went right across the whole pathway. So the first part is the stage 3, that post-diagnostic support stage, aligned to the 5-pillar model of post-diagnostic support. So we invested in an additional link workers, which has had a significant impact on the service. There's been introduction of weekly meetings, and that is in collaboration with the Alzheimer's Scotland manager and older people's mental health team lead, and also the link workers. We've completed the quality improvement framework for post-diagnostic support. We're almost completed a standard operating procedure for the post-diagnostic support service, and that will include data requirements, that is required for the post-diagnostic support local delivery plan standard. So there's a target associated with post-diagnostic support for those that don't know. And also we're looking at the role the post-diagnostic support link workers have in early housing assessment and anticipatory care planning, and training is planned for both of these. In terms of the standard operating procedure, one element of that was to look at, make sure that the person, depending on their stage of dementia progression, received the most appropriate post-diagnostic support from a relevant professional, whether that would be the link worker or whoever's coordinating that care for them. So I've just wanted to share this kind of pathway and decision-making process. It's still in draft, but it's something that will be incorporated into the standard operating procedure. Janice Stewart, the post-diagnostic support lead who manages the link workers, has been implementing the post-diagnostic support single quality question. So Inverclyde were involved in testing this previously. So this is now, we're now looking for this to be used right across Scotland, aligned to the local delivery plan standard. So this is some of the feedback that she's received so far, and you can see that people do appreciate being asked for feedback, which is important to know. They really appreciated the relationships. They felt their mother was listened to, and just having that link worker, that main contact, was always, was important, and it just emphasizes the importance of having that somebody with dementia has somebody that they can speak to or contact, and you can see that the support they provided was really valued. And finally, I just wanted to share some data. We had 85 people on the waiting list prior to the additional link workers coming into post. And then by January of this year, that waiting list had come down to 31. But during that time, there was 135 referrals. And actually, the caseload is well over 150, which is really practically at their maximum. But the good thing is that some of the people that have been receiving support will be coming up to the year, so they will be able to start seeing other new people as well. That will be ongoing. So the fourth stage of that diagram I showed you at the start was that the care coordination stage that's aligned to the 8-pillar model of community support. So the areas of work that we're doing within this is defining the care coordination role. So you can see the 8-pillar model. There is the dementia practice coordinator. We want to describe what that looks like within Inverclyde. We're also collating a services and supports document, and I'll talk about these later. And also, you'll know from previous work done in Midlothian, they identified 12 critical success factors for really good care coordination. So we've done a self-assessment of that. So I'll talk about that later. So in terms of that care coordination type role, we had a learning session back in May last year to explore this. We wanted to look at the role of care coordination within Inverclyde, the different levels, and examples of it in practice, and then we wanted to look at areas for improvement. What is it we needed to do to ensure really good care coordination within Inverclyde? So in this session, we explained what the care coordination role is and the levels of that. So it could be a single intervention, or it could be something more longer term. But what's really important is they look at that person holistically. They'll do an assessment of need, care planning. They'll be signposting and referring to services. So with this in mind, we have collated a document that explains the care coordination role within Inverclyde, and that's finished now, and that will be shared. And it actually includes the 8-pillar model and the services within Inverclyde that align to each of these pillars. And I'll be talking about another document, a supports and services document for Inverclyde, because we also align it to that as well. Okay, so after that learning session at the end of that learning session in 4, we asked people who attended that, well, what is it that's needed to improve care coordination within Inverclyde? And what came over quite clearly was that people wanted to understand roles and responsibilities better right across the health and social care partnership, or right across Inverclyde, and also clearer pathways, understanding these services and supports and how to access them. So with that in mind, we had a learning session towards the end of last year that looked at all these services and supports, and people then came along and did a speed presentation about their service, and we got really good feedback on that. But what people did was collate information about their service on a document, and that then was contributed to a bigger document, this one. So this is currently being drafted in with support from Healthcare Improvement Scotland. They've edited and make it look really nice. So we have 4 different types of services. So it's GP practice and primary care, health and social care services, mental health services, and also third sector services. So within that, what I'll say is that it's almost completed. We just need a couple of additional services added, and when it's finished, it will be shared right across Inverclyde by all relevant health and social care and community third sector services. So this is the template that people use. So for each service, they will say what they're provide an overview of that service. They'll say what support they offer people living with dementia and carers. What is the referral criteria and how do people access this service? So that every single service will detail this within that document. Also, we looked at the 8-pillar model. Now, this is a slightly different variation of the 8-pillar model. Still the same pillars, but it's the artwork's changed. It's a more up-to-date version. But what we've done is aligned to every single pillar supports and services within Inverclyde. And that's what the services document has. And in the care coordination role, it talks about this as well. So it's kind of bringing it all together, that source of information. And then I mentioned about the 12 critical success factors. So we've done this self-assessment. We've met the requirements for some of them, but others there's some improvements that we need to do that will continue beyond this programme for the sustainability plans going forward. Okay, the 5th stage was this advanced dementia practice model, or the advanced dementia stage. So a requirement of this commission was to test Alzheimer's Scotland advanced dementia practice model. So we set up a working group to agree how it's applied within Inverclyde. And elements of work that came from that is the identification tools to be able to identify palliative and end-of-life care and dementia. We want to identify who our advanced dementia specialist team are within Inverclyde. And also we wanted to establish an advanced dementia specialist forum, and we set out to test and evaluate this. Okay, before I go on to talk about that, I just wanted to share a couple of slides with some data that Public Health Scotland have done for us within Inverclyde. It's not actually published yet, but once it's published, I'm sure it'll be shared across the networks. But I don't think this slide is new news to people. I think you'll know this, but it looked at mapping the number of people with dementia, and as you may know, it's quite difficult to actually know the exact numbers, so it all depends whether somebody's actually goes to get a diagnosis or receives a diagnosis, and that's recorded somewhere. So there's 2 different approaches. The orange one is mapping that Public Health Scotland done, and the blue one is a Eurocode approach to calculating the number of people. But what's important here, they did it for Inverclyde in 2018, and then they've predicted how it might increase by 2040, and they're predicting this will increase by 40%. And this next slide is Scotlandwide, and they looked at everybody with a dementia diagnosis and what stage their dementia is at, and there was a process to that. So as you can see, in 2020, well over 50% of people at that time were in the more severe stage of dementia. I have to say this surprised me, because I thought the majority of people would sit in that moderate stage, because that is quite varied. But what's more important as well is that they're expecting or predicting this might increase by 75% by 2040. So I think these 2 slides further emphasise how important this care coordination work is, and in particular the work we're doing around that advanced dementia stage. So in terms of Inverclyde's approach to in applying the advanced dementia practice model, Inverclyde have agreed a needs-based approach to advanced dementia care and support in Inverclyde. So the bottom part of the pyramid here is where advanced needs are being met by current support arrangements. So that person who's coordinating the care for that person will ensure there's person-centred planning in place. They will be able to identify that their dementia is becoming more advanced, and we're planning workforce development around that and ensuring that staff are aware of the role appropriate identification tools. So they will be able to continue supporting that person and recognise when things are becoming more advanced and make sure that they receive appropriate palliative end-of-life care support needs. The top part of the pyramid here is when advanced needs are not being met by current care and support arrangements. So the person who's coordinating that care has identified an unmet need, and suggestions we've given here might be the person with dementia or the carer themselves are experiencing stress and distress, or there might be a need for more focused symptom management. So what we're suggesting here that if there is unmet need, that case is brought to for discussion by the advanced dementia specialist team, who come together in an advanced dementia specialist forum, which is what we've tested and evaluated within Inverclyde. So before I come to talk about the forum, I just wanted to mention about the work that we did in terms of identifying advancing dementia. So we realised that was a gap. There's many identification tools, but not all was necessarily for dementia. And we know the progression of dementia is varied over a longer period of time, and quite often it's not picked up until end of life. So we had a short life working group to agree a tool or a basket of tools for staff from a clinical and a non-clinical background. So that work's concluded. And just to say, it wasn't possible for us to determine one tool over another. It really depends on the role of that person and the reason. For example, do they want to identify symptoms and concerns? Do they want to look at early warning signs or rate of change? So what we're waiting for now is the recommendations for the forthcoming site guidelines, which are coming up shortly. So the Advanced Dementia Specialist Forum. So what we wanted to do was test and evaluate this within Inverclyde. So there's a standard operating procedure in place. We're up to version 17, and that incorporates all requirements of the forum. For example, the purpose, what it's trying to achieve, what it'll improve in terms of hospital admissions. It also it details the business process for this, which was done by myself as part of the test. We've included who the advanced dementia specialist team are. So we agreed to test it for a 6-month period, and we set up meetings once a month on a set day and time. Identifying cases were really difficult, and we were only able to provide cases on 2 forums, and 3 cases were presented in total. So that in itself is learning, and we set out to kind of understand that through the evaluation. And as I say, I completed an evaluation of this. So this is just to let you see who our advanced dementia specialist team are. So you can see it's health, social care, and third sector organisations with individuals within Inverclyde. So in terms of the Advanced Dementia Specialist Forum evaluation, so what I did, I used a mixed methodology. So what I did was I collated feedback that we received from the first forum that was delivered. I also received feedback from those presenting the cases, and this was directly following the forum and then approximately 4 weeks later. We got people to complete an online reflective questionnaire, so that was sent out to about 30 people, 9 completed that. And also we arranged a face-to-face reflective discussion session. 6 attended that. 2 of those also completed the online questionnaire. I also collated feedback from the GP forum, Inverclyde GP forum, where I spoke about the advanced dementia work that we were doing. So all sources of feedback were collated and reported. So I'm not going to get into any great deal of detail. That will be included in the actual report, and that will be shared soon. So the overarching themes was that it was thought it did address unmet advanced dementia needs, in particular when cases are really complex. And it was also beneficial for staff who presented the case. They really valued it. There was recommendations that were given that were really helpful that hadn't been considered, or gave the confidence to act on some suggestions. And also we found in particular one case where it did support that person to stay at home rather than being admitted to a care home. So that's exactly what we want it to do. It was seen as a really good learning and development opportunity. There was greater understanding of services and supports available, better understanding of roles and responsibilities, and how to manage really complex cases. That they were all really valued. And then what was particularly valued as well, which came out recurrently throughout the feedback, was that multi-agency approach. But what was also important, that it didn't duplicate existing multidisciplinary team arrangements. That was really important, and we need to be clear what the added value of the forum is. So that's really important. So it is suggesting the forum should continue, but it does require some review. At the, for the test, it was a set day and time. So suggestions were as how this would better address unmet need as it arises, and we would need to consider how we could bring that advanced dementia specialist team together at short notice. So that really needs to be considered. And then how better do we identify cases? And there was lots of suggestions, such as having using retrospective cases to bring people together to discuss, and then that might in turn then make people realize that if I'm faced with that situation, then maybe I could come and discuss it at the forum, or just being able to shadow it. And obviously the wider promotion of it, that needs to continue. So in terms of recommendations and next steps for this, for the Advanced Dementia Specialist Forum, so we want to continue to ensure within Inverclyde that the best possible person-centred palliative end-of-life care and support is provided. We want to continue exploring the needs-based approach to advancing dementia. We want to realise the learning and development opportunity that the forum provides. We want to, it was suggested that we continue with the Advanced Dementia Specialist Forum, adapt it to in terms of the feedback, but also further test it just to see if it does make a difference. What was clear, that it needs to have appropriate leaderships to drive it and take it forward, because it was felt if that wasn't the case, it would just fall away. And this will form part of Inverclyde's sustainability plans going forward. Another piece of work that relates to the advancing dementia work is learning people with a learning disability who also then have advanced dementia, and their needs are such that they require a home care placement. And feedback within Inverclyde that this is really difficult to obtain a care home placement. So we fed this back to our national colleagues in the Care Inspectorate, and it was recognised quite quickly that this was an unmet need right across Scotland. So a working group was established, and we have national representation from Scottish Government, Healthcare Improvement Scotland, Care Commission, University of Stirling, and sort of wider partners as well, and also local partners. So with this work, we engaged with care homes to understand some of the barriers, and also we did some engagement through case studies with people with a learning disability and dementia, their family or carers, and care providers. So bringing all this information together and expertise, we've drafted a guidance document, and that's going to be an output from this piece of work. And this will then be used for health and social care staff to be able to then appropriately, when needed, to place somebody with advanced dementia and a learning disability within a care home. And it's going to sit with it on the Care Inspectorate website. And there'll be sort of communications about this throughout Scotland. And this was a piece of work that generated from the Dementia Care Co-ordination work. So really good. So I'm going to just talk about overarching actions right across the whole pathway. So a recurrent theme throughout our engagement with local stakeholders was the need for dementia-related workforce development. So we were able to, through separate funding, to recruit a 2-day-a-week dementia training coordinator post for 18 months. So her role will be to ensure by the end of that 18 months there's a sustainable approach to workforce development, and it was very much aligned to the Promoting Excellence framework. So they'll focus on delivering a dementia-informed and skilled level across Inverclyde, but also looking at master classes around the more enhanced level of knowledge and skills that are required. Also, our leaflet, our services and support leaflet, that was an output that was co-produced by our dementia reference group and also our stakeholders. Excuse me. And this one, I've just received some feedback through our post-diagnostic support link workers, and it does seem to be really valued. They like that it's simple and it's easy to, some people have got it up in their fridge or in their bag, and people have actually started contacting services within this. There are some feedback that we might, and how it could be improved, and that's kind of things we'll think about going forward as well. We are currently in the process of developing a Living Well with Dementia app. Again, that will be for somebody in the early stages of dementia, and it has elements that they can record their well-being, that they can record and share what matters to them. You know, if they then record that there, they could potentially share that if they were to go into hospital, or if they're being supported by a care coordinator, they're able to share that potentially. There's obviously further information and the services and supports that are aligned to our leaflet here. So at the moment, the information has been populated onto the app and it's now been checked for in terms of accessibility. So hopefully that will be tested. And it's also, it was co-produced by people living with dementia and their carers as well. We've reintroduced our dementia-friendly Inverclyde work, again through separate funding that this has been put in place. And through a commissioning process, Your Voice within Inverclyde are taking this forward. And they've started last October, and they've already engaged with over 130 people with dementia and carers who then are informing the work that's been taken across, within Inverclyde. And this is through their engagement, they've developed this brand and logo. And I think you can agree it looks amazing. I just think it's amazing what they've done. Other actions, looking at the role of allied health professionals, and in particular, the delivery of occupational therapy interventions, and Kate Lawson has led on this locally, looking at delivering and evaluating these interventions, and many of these have been done face-to-face over this, even during the pandemic, and it's been valued, and that has been presented to national forums around the learning from this. We're looking at, we've incorporated the HSCP work around anticipatory care planning, because it's important to get that anticipatory care plan early on. And we're looking to train our post-diagnostic support link workers, as I said previously. And our older people's mental health team lead sits on this group. So the anticipatory care plan will be incorporated within the dementia supports. I've also engaged with GPs last November. As you can imagine, it's been quite challenging to engage with GPs just because of the impact of the pandemic. But we did speak to them at their forum, and just to update them on the programme, but they were particularly interested in the Advanced Dementia Specialist Forum. They see the value of that, to shadow that and learn from it, but also to support them in their role in supporting people with advanced dementia. They've seen that was really important and really valued. And also this work, Stephen Lithgow from Healthcare Improvement Scotland plans to continue housing and dementia framework, implementing the housing and dementia framework. And there will be a workforce development element within that, and she's going to link in with our dementia training coordinator. So in terms of next steps, so our programme ends today or tomorrow. So we have end of programme events planned, and this is one of them. We're now in the process of evaluating the programme to capture and share learning. So that's happening at the moment. We also have a measurement plan in place, and that data will help to inform the evaluation, but also will be used as part of Inverclyde's dementia strategy, because it's just been agreed that Inverclyde will re-establish their dementia strategy, and that will be co-led by the Head of Services for Health and Community Care and Mental Health Services. Thank you very much, and that's my presentation finished.